Good morning, everyone. This call is being recorded. My name is Christy Angel. I am the president for the Citywide Council for District 75. We do expect a few parents to funnel in here a little bit late, but that's all right. Today, we are very excited to have the Manhattan Psychology Group with us today again to walk through another great space, and it is our neuro talk. We're going to be talking about neuro assessments, what that means to you, what it looks like to have them paid for, and any other question you may have or what you may not know that you don't know. So we're very excited to have Dr. Jessica Randall Janicola here to give us the presentation. And with that said, I will go ahead and give you the floor. Thank you so much for being here today.
Thank you so much. Wonderful. So yes, I'm Dr. Janicola, and then I'm working with Dr. Davis, who might be jumping in. And she is also here in case I have a clinical emergency where I'm at. If I have to step out, Dr. Davis will take over. So we are very excited to be here today. I am just going to share the presentation. Okay, wonderful. Can you guys see the presentation? Great. So today we are going to be talking about neuropsychological evaluations. We're going to walk you through the process from start to finish, and just talk through sort of the purpose of a neuropsychological, what it entails, and basically what you're left with at the end of the evaluation. So first, what is a neuropsychological evaluation? So these are comprehensive assessments, and we assess across a variety of areas: cognitive, emotional, adaptive, behavioral. We look at the functioning of the client in all of those areas. And we use standardized testing measures along with clinical observations. And we use both direct and indirect measures. So a direct measure is more of a hands-on task, and an indirect measure might look like a rating scale, clinical interviews, and so forth. I'm going to get into it a little more, but we look across areas such as memory, attention, language, adaptive, problem-solving skills, social skills, emotional skills. And the purpose is really to understand how your brain is functioning and what that looks like in your daily life, and then figure out a guided treatment plan based on what we find. So what are different reasons that evaluations are requested? There are a variety of different clinical reasons for why an evaluation might be requested. Oftentimes, they're requested from either a healthcare provider, alongside families, educators, anyone who's looking to seek a better understanding and make care decisions. These evaluations are usually requested for diagnostic clarity, assessing the client's strengths and weaknesses. Sometimes they're requested for monitoring symptom progress or treatment progress. And oftentimes they are also initiated to guide educational planning. So now we're going to start to walk you through the steps of the neuropsych. So there are the pre-assessment steps. This would be the preparation of the clinician. I see someone's here, so I'm going to go ahead and let them in.
I'll be your person
Wonderful.
on this
Okay.
side. I got you.
Perfect. You got me. Thank you. So there are 5 general steps that we do to prepare for a neuropsych. So typically we start with collecting any medical or background, any history that might exist, whether that's past diagnoses, past evaluations, any medical history, any neuropsychological events. And then we go through and we review that history. So we try to seek an understanding of developmental milestones, the full educational history, any early developmental factors. And in tandem, we also collect psychosocial information. So we're looking for information about, family dynamics, educational history, any current stressors. We then clarify the referral question. So why are we here? Why are we seeking the neuropsych? And we clarify, what the purpose is for the evaluation, along with any previous evaluations. And then we typically just explain the process to the client, which is part of what I'm doing here, where we explain the process, we explain the duration, we share, what to bring to the appointment, what you can expect. Then we begin with the evaluation. So there are several components to assessing functioning. Typically, we start with an intake, a clinical interview, where we meet with the client and or the client's guardians. And that is where we're corroborating any of the data that was provided for us. corroborating any previous evaluations. Then we move on, and I'm going to go into this further. This is just the overview. We move on to the cognitive testing, which typically includes intelligence testing, memory, attention, executive functioning, language. Then, based on the referral concerns and the needs, we'll do social and emotional assessment through direct and indirect measures. We'll look at adaptive functioning and behavioral observations. So we're looking for each component to share more and more about the client's strengths and weaknesses. So moving along, what does the testing process look like? So a typical testing session, it's the duration is very varied. Some sessions are as short as 3 to 4 hours. Sometimes the sessions can last 12 hours or more. So it just depends on the client's activity level, how quickly they're moving through the testing. It also depends on what we find in the testing. If there are areas of weakness, we will typically what we call follow up on those areas. So we might give additional testing based on what we're seeing. Testing's taking place in a quiet, controlled environment with minimal distractions. That's typically in one of our offices. However, at times to accommodate families, we will find a safe space in the client's school where we can test there if that's easier. Additionally, at times, we will go into the client's home if there are physical limitations or if that's easier for the family. All of our assessments, we're using standardized measures, standardized administration processes to ensure reliable and valid results. So welcome to everyone who is joining us. We're just walking you through the testing process. Next, we are going to move into the different types of tests that are used in a neuropsychological evaluation. So I spoke earlier how we'll typically start with cognitive testing. One of those measures would fall under the umbrella of intelligence tests. So that was looking to assess overall cognitive abilities and functioning. So that's going to be looking in the areas of verbal, visual, working memory, processing speed, etc. And typically we use measures that fall in the Wechsler family, such as the WISC. We also use Woodcock-Johnson measures, such as the WJ. We will also use the KTEA. So the way that we decide which intelligence measure to use is typically based on what's been given in the past, because a certain length of time has to pass before giving the same measure. Sometimes we will want to give the same one that was given years ago to see if there's progress. And other times we end up giving across multiple batteries because we want to corroborate a low or a high performing score. Then we'll move into memory assessment. That will evaluate both auditory and visual memory and recall. And so oftentimes we will use something called the RAML. Other times we will use the CBLT. And the format that we choose to use is typically based on the client's profile. For example, the RAML is much lengthier. So if there were a client with attention deficits, we might choose not to use that one. Then we look at attention and processing. So this includes both hands-on task direct measures and indirect measures such as rating scales. Oftentimes for direct measures, we use a task of visual attention, a computerized task called the CPT-3. We do have other hands-on tasks on the NEPSI, the DCAFs, which is not listed here, but is listed below. And there are some attention scales on the RAML that we can give. Similarly, we look at executive functioning. We'll use, crosses over with the attention evaluation as well. So hands-on tasks, including the NEPSI, the DCAFs, and then there's also indirect measures rating scales, such as the BRIEF or the CEFI. Finally, we look at social and emotional behavioral and often adaptive functioning. And that will be through on-task evaluations, such as on the NEPSI, but a lot of indirect evaluation rating scales, such as the BASC, the Vineland, the Connors. And oftentimes, with permission from the family, we will speak with the school to complete these rating scales as well. So these are the types of tasks that we might give in a neuropsych. So then we sit in that 4 to 12-hour session. We take all the observations, we take all the background information, we take everything that we gathered from all of our conversations and testing sessions, and then it is the clinician's job to score everything and interpret it. So the clinician is responsible for understanding the test results, not in isolation, but focusing on the client as a whole. So we take what we would call raw scores and we convert them to standardized scores. And that allows us to compare students to others, either their same age or their same grade, to give us a universal language for comparing their performance to others and basically where they should be performing and then where they are performing. We integrate those scores with the whole clinical history that we've gathered, the behavioral observations, and we're always keeping the referral concern in mind. And like I said before, we use, highly reliable and valid sources to make sure that our results are accurate and meaningful and that they apply to the referral concern in the different settings that we're looking at. And like I talked about before, we always want to corroborate what we're seeing and what is being reported to us on rating scales and interviews with what we're seeing on direct measures as well, and vice versa. So after all of this is done, the clinician will report the findings to the family. So at the end of an evaluation, you are given a comprehensive document that is very long, and so we break it apart for you. So we give you a summary of the testing results. We explain the scores and the performance. You are also given diagnostic impressions and conclusions. We explain the functional impact of what we found. And then we provide recommendations for intervention or accommodation to help guide a treatment plan. If the family would like, this evaluation can also be shared with school. We can also present the evaluation to school. And if there is a lawyer involved, we will also share the evaluation with them. Once all that is done, it's wrapped up in a feedback and recommendation session. So the feedback, we try to take what sometimes can sound like jargon and make it accessible to you. So we will give you a clear explanation of strengths and challenges for the student. We'll share the results and recommendations. We'll help provide you with next steps, whether that's connecting you with different treatment providers or providing you with a list of additional resources. And then we just have an ongoing, collaborative discussion for treatment planning. So that brings us to the end of the main bulk of the presentation. I would love to open up some time for your questions and discussion based on everything that I shared. I'm also happy to go back to any slides that you guys want me to go back to.
For those that came in a little bit late, could you maybe go over the first one or two that they might have
Of
missed with the
course.
slide? Thank you.
Absolutely. Back to the beginning. Yes. So at the beginning of the presentation, we were just explaining what a neuropsychological evaluation is. So it's a comprehensive assessment with a trained specialist, and we are measuring different areas of functioning, whether that be cognitive functioning, emotional functioning, behavioral functioning, adaptive functioning. And we look at a variety of different areas, such as memory, attention, language, problem solving, social, the list goes on. It depends on your referral needs as to what we're assessing. It also depends on what we're finding in testing. Based on what we find in testing, we might do additional testing. And then I just walked through, what is an evaluation? Why are they requested? So neuropsychological evaluations are typically requested from families, but they can also be requested from healthcare providers or educators. And typically families are seeking to have a better understanding of cognitive functioning and to guide decisions. Sometimes those are educational decisions. They might be future planning decisions. Typically, in neuropsych, we're looking to assess cognitive strengths and cognitive weaknesses. We're also looking to monitor symptom progression or if there's been treatment involved, how that treatment is going, and to guide educational planning, as I already shared. Also, if there are previous diagnoses, we can confirm those diagnoses or report on the progress. I can go through about one more because this slide goes through a general overview of the steps of a neuropsych. So typically when we're beginning a neuropsychological, we do a lot of gathering of data. We do a really thorough record review. So at this point, we would be reviewing past diagnoses, any previous evaluations, any important events, and basically the family shares any record that they want us to review and include in the report. We get a really solid understanding of developmental milestones, educational backgrounds, what's been successful, what's not as far as school goes, and any early developmental factors that might be important for us to know about the client. We also collect psychosocial information, so anything about family dynamics, like I said, educational history, any current or past stressors. And then we're always wanting to hone in on our referral question. So, why are we getting the evaluation? We clarify the purpose of the evaluation, and again, we corroborate it with any previous evaluations. Finally, once our evaluation is done, we are explaining the process to once we go through all of the gathering of information, we explain to the client what the process is going to look like, what to bring to the appointment, etc. Would it be helpful? The next slide was talking about the different components of the evaluation. Would you like for me to go over that too?
You might be able to go over, but also, would you be able to talk about the differences of, schools can do evaluations too, right? So
Yes.
what's the
Yep.
difference between a school evaluation, your evaluation, whether they waive it to not have the school do it and to do the independent evaluations with you, what that may look
Sure.
like, and how they would move through that process?
Absolutely. So I'll leave this screen up because it's relevant. So when you're getting a neuropsychological evaluation, it's much more thorough than what a school is going to do. Typically, schools do psychoeducational evaluations. So they do mainly just the cognitive testing, and oftentimes they won't even do memory. Sometimes they do attention and executive functioning, but sometimes not. So I'll cross those out because more oftentimes than not, they don't. Sometimes they do a little bit of like social emotional rating scales, but oftentimes they do not. So I can put a question mark there. And then a school will also do educational testing. So that is included in our testing as well. So your a school also, I'm trying to not use jargon, but basically a school will often give a very set battery. So they give every student the same thing versus when we do a neuropsychological evaluation, we have a battery that we prepare. A battery is the instruments that we're going to use to do the testing, but we constantly modify that based on what we're seeing in testing. So that allows us, if we see a low score, to follow up. Okay, why was that score low? Was that something behavioral? Was that task hard for them? We can really dig into why there might be a low score and or a high score versus a school. Typically, they're just giving the same battery, they report on it, and that's the end of it. I would say that typically, if you start with a school evaluation and there are really no concerns reported, you might be able to end there. But if you do a school evaluation, there are no concerns reported, but there are tons of concerns being observed in the classroom, then clearly what was going on was not uncovered. And at that point, it would be best to get a neuropsychological. Um, what was your other question that I didn't tap on in regards to a psycho ed versus a neuropsych?
You might have tapped into it. I'm not sure about the payment side of it or what it looks like. I know for myself, I've been through technically an impartial hearing, which is where I had my neuro brought in and then things of that nature. So we may have people that have never been in an impartial hearing, don't know that this could be a part of it. So we may have like two
Hmm.
different levels of parents with the understanding. So what I want to do is now jump over into some of the chat so I can give some space to parents to ask some of the questions.
Sure.
So I'll start
Great.
with Miss Rosalia Verdes. We do not have Spanish interpretation today, but I'm going to put her answer back in Spanish. I'm going to try to translate for her to put her
Great.
answer in. We also have a question from Stephanie Lee. I am actually looking into a neuropsychological evaluation for my daughter to see where she is on the spectrum. Um, we will drop their information into the chat, or Dr. Davis, would you be able to drop the information as I read through to assist them to reach out to Manhattan Psychology Group?
Yes, I can do that.
Thank you so much. I see Leslie Gadamer. Hello, is a psychoeducational evaluation report the same as a triannual? I think you might have, you're muted, Dr. Janicola.
I don't know how that happened. Anyway, the short answer is yes. I'll give you a slightly longer answer. So once you are evaluated as a part of the DOE or the Committee of Special Education, you guys might have heard the term CSE. They're who get together and decide if you're eligible for an IEP, an individualized education plan, or not. So let's say the CSE classifies you as a student with a disability and you get an IEP. You then have to get reevaluated every 3 years. And that's why it's called a triennial. Every 3 years, the school is required to do updated testing. What you do for that testing is what we're talking about. So typically schools, let me just take a quick sip of water, will do a psycho ed. Most schools are not doing neuropsychological evaluations. They're just focused on the cognitive functioning and the academic functioning. That's what a psychoed is. At times, schools will look a little bit into attention and executive functioning. They might also look a bit into social and emotional functioning, but they're not as thorough as a neuropsych. For your triennial evaluation, every 3 years, you could also get a neuropsych, but that is not what a school will typically offer you from the start.
Okay, I have Siobhan Kennedy. Guys, I'm going to read the stuff off in the chat, but do feel free to raise your hand and then I will come to you. How often should the neuropsychological evaluation be done?
Yeah, that's a great question. So typically they're done every 3 years, which aligns with the CSE. The triennial happens every 3 years. So typically a neuro happens every 3 years. Sometimes when you get a neuropsychological, we might give you a specific recommendation of having follow-up testing sooner. So let's say we discover that the client has ADHD. They're also not doing well in reading. We might not give a reading disability because we might not be able to tease out if they're struggling with reading because of the ADHD. So we might write a recommendation such as, we're recommending that you get the X, Y, and Z intervention for the ADHD, then come back and let's reassess the academic to see if the reading improved after that intervention.
Okay, this also says, my son is a teenager and started D75 high school, but I'm having a lot of problems with aggression. Can I, as a parent, request a neuropsychological evaluation?
So you as a parent can request that the student is reevaluated. Typically, what the school will offer is a psychoeducational. If you've gotten those in the past and you don't feel that they've been helpful, you can then request an IEE, an independent evaluation. And the school can choose to accept that request or not. So that would be, sorry, I didn't say the whole thing, an independent educational evaluation. What we were referring to earlier is at times schools will deny that request. And so at that point is when you can seek counsel. So you can work with a lawyer to help essentially sue the DOE so that they will pay for you to get an IEE.
And just know it is your right to have an independent evaluation. You do not have to be in a space to be forced to have your school do that evaluation. I have this as well. Another person is saying their son was evaluated, but they've never had him evaluated for this before. So if we can make sure for Miss Alicia George that we actually put that information back in the chat, I'll drop some of your information in as well. And then Stephanie Lee asked, does insurance cover this?
So possibly is the answer. It depends on the insurance that you have, but I don't have a definitive answer to that because sometimes they don't cover it. But if you
Oh,
are seeking reimbursement through the DOE, then you would get reimbursed for the evaluation if the DOE does pay for it.
Alrighty, I'm going to take a break on the chat. I see Miss Shantea Martin has had her hand up for a moment. Shantea, you have the floor to ask your question.
okay, so I have my son, he's 6, and I took him to a neurologist at his primary care doctor. They wound up putting him on medication. But the medication that they put him on, it doesn't seem to work with him right. And now since I took him off the medication, it's like his aggression has been become very hard. So I'm not sure if I did the right thing or the wrong thing, but I know that when he was on the medication, he was very incoherent. So I'm trying to figure out if medication is the choice for him or not, or should I just go through what you guys are talking about now to make sure that this is the right choice to make.
Right. Has he been evaluated through the CSC at school yet?
I'm not, no, I don't think so, no.
Okay. So I think that's a good place. Are they seeing an impact in school with his behavior on his
Yes.
academic
So
performance?
his performance, they call me every day and they like, oh, he's aggressive. He's being more aggressive ever since I took him off the medication. Now he don't even like to go to school no more.
Yeah. Yeah, I'm sorry that this is happening. I would I would first and foremost recommend reach out to the school and put in writing that you are requesting an evaluation due to the increase in behavior and the impact on school. So you always want to put that in writing because that's your formal request and the school has to honor your request. After that, just given that you're in a little bit more of a heightened place right now, I would definitely consult with the psychiatrist and let them know everything that you're seeing. There are, not that we're really getting into this in this presentation, but there, and this is not my area of specialty, so I'm just going to make a general comment. There are a variety of different medications for ADHD. Some kids don't react well to certain ones. But they might react better to a different one. So I don't want you to lose hope there if that is the route you want to go, but you should still start the evaluation process at the same time.
And just
Okay.
as a mama who has a baby, Miss Martin, he's been through a lot, and it took a lot for us to get him a psychiatrist to be able to go through medications. I want to be honest with you. When you work through medications, you're probably going to work through a group of them. My son has tried at least 7 different ones. Some of them made him extraordinarily more aggressive. Some made him gain weight. And now we're kind of in a space where things are working. So I just want to say, parent to parent, it can definitely be trial and error. And if your child does get more aggressive and things of that nature, it is something that unfortunately can happen, but with the right doctor, they can try to work and figure those things out. So I would say just stay in touch with the Manhattan psychology group and just see what level of doctor that you can find that has a care and understanding of our babies, because sometimes you may not find that. You may find a nurse practitioner, but as long as you find somebody who can feel comfortable listening to you about what's going on with your child, that'll make the flow a little bit better.
Okay. Thank you so much.
You're welcome. I'm going to head over to the chat. We see a lot of people that are asking. I know this is a Manhattan psychology group. Do you cover other boroughs? Because one mother was asking about having her son evaluated, but they are in the Bronx. And is this specific to ASD students or other than the ADOS?
Yes. So to answer the first question, we have a couple of different offices and we definitely service, I mean, there are clients who come from other states to get evaluated at Manhattan Psychology Group. So we can go, like I said, you might have missed earlier in the presentation, I was sharing that while we have a few different offices, we also can accommodate families by either going into the child's school and testing them there if that's easiest. We at times have gone into a client's home if there are physical limitations, or again, if that's easier for the family. So we don't want anyone to be limited by location to get the evaluation. That was question number one. Question number two. So we do all sorts of evaluations at Manhattan Psychology Group. If there are concerns regarding autism, we will do what someone was referring to as the ADOS. That is considered like the golden standard for assessing autism, but there are a variety of other methods to assess for autism. Um, a family might come in and that might not be a concern of theirs, but then we might observe behaviors where we're questioning, could this be autism? And then that will just be included in the neuropsych. So a neuropsych, a neuropsychological is very tailored to the student and their needs. And so that could or could not include an autism assessment.
Okay, I know that I might have mentioned this before, but Ms. Hai Chung said our schools required to follow all of the recommendations made in the neuropsych report.
So not necessarily. Typically, when you present the neuropsych report, you present it in what I was talking about, the CSE, the Committee of Special Education. And at that time, the recommendations are presented, but technically speaking, everyone in the committee has to agree on those recommendations. So there has to be a need, that it's a proven need and a benefit to the child for everyone to be in agreement on the recommendations.
Wonderful. And then we have, oh, that's Kylie answering. Thank you. Um, we're going to go over to Ms. Shauna Demesia. You have the floor to ask your question.
Hi, everyone. Thank you. So this is kind of like a little bit of an interesting situation. My daughter has been part of CPSE and was also recommended to be in an ICT setting for kindergarten. And kindergarten was really rough last year. Like we made it by the skin of our teeth. And I asked them to have her reevaluated for her IEP in kindergarten. And kindergarten came, the reevaluation came, and they basically recommended that she still stay in ICT because she did not have an autism diagnosis, and it was in her best interest to just kind of follow suit. I then hired an advocate to review her IEP and recommend, what we should do with this because, the IEP is sometimes spoken in a different language. We all know that, right? The
Yeah.
IEP, the IEP came back. The advocate recommended that she stay in self-contained for ELA and then stay in an ICT setting for the rest of the day. Um, so
Okay.
that was so that was fine, and we did that for 26 and 27 school. I'm sorry, 25, 26 school year. When I tell you, I've gotten really no complaints, but her report card was really all in the twos and the ones, and her grades were like mid-level, like they were 80s, 60s, 70s, no behavior issues. She clearly needs reprompting all the time to get her work done, and she clearly has a comprehension problem. So we go to her IEP meeting and they basically tell me like, well, we're putting this child fully in self-contained for next year, like fully self-contained. And I mean, my husband and I were flabbergasted. One, how do you tell us this in June? And two, absolutely not. Like we want to make sure that like is there a protocol, I guess, in the DOE where they should be doing some sort of assessment to determine she should be in self-contained? And if not, if I do request for a neuropsych eval, would they be able to provide like a voucher from the DOE to provide that? Because everywhere I look to get a psych eval, a neuropsych eval, it's literally $7,000 out of pocket.
Hmm.
And I can't afford that. And honestly, I don't know what to do here. I've gone through the proper channels since she's 20 months old to make sure she is getting the right evaluations. But is there a more in-depth evaluation I should be requesting for them to move her to self-contained?
Yes. So just to fill the audience in. So I know I've referred to it as CSE. And Shauna, you were saying CPSE, that's the preschool committee. So I
Yes,
just don't
it
want
was.
anyone to be confused.
Yeah,
So
sorry.
so no, you're good. I just wanted to explain to everyone. So legally, the school is required to have your child in the least restrictive environment. So that's why they were saying ICT, ICT, ICT. Then they put her in
Yeah.
self-contained ELA, I guess, because she showed a need in ELA. but now they're saying full self-contained. And the question is this too restrictive for her needs? So
Correct.
so essentially what you would do, did she get reevaluated at all? You said she got
Never.
reevaluated.
No. She got
Okay.
reevaluated during kindergarten, and that reevaluation came back, no, she should stay in ICT. And
Right.
then I took that eval and the IEP, and I took it to a lawyer advocate, and they were like, I would suggest that
The
you do a
self-con,
high
right.
self-contained for ELA.
Yeah.
And it
Right.
worked. It's been great, you know?
Yeah. So the school
Um,
is not allowed to change your child's program without your permission. So they can't say, oh, now she's in self-contained, because you as a
right.
parent can say, I disagree with that program. I want to keep her in ICT and self-contained ELA. So that's first and foremost. They cannot change her program without your
Okay.
consent. So there needs
Okay.
to be, I'm sure this is every year, there's something called an annual review meeting. That's probably
Yes.
what, was there a meeting that you had this
Yeah,
year?
I felt like
So
I was
in
on A&E intervention. It was like out of nowhere. I mean, I knew I had the
yeah,
IEP meeting, and I was I'm the class parent. I'm very vocal, very communicative. I've been to every event. They've never once pulled me aside and said, "Hey, like this is not the route we think this is good for
right.
her." They just kind of hit me with it and like, "Okay, well, we are recommending self-contained." I'm like, "On what
Yeah,
basis?" You know?
right.
So I think
Right.
that's my question. What basis do they need to do to formally say this is the right approach without an eval?
Right. So first and foremost, you need to say that you disagree with that. Then to answer
Yes.
your, and then they cannot move her. The second, so you would submit a written disagreement with that policeman request, with what they recommended.
Right.
Then, so typically a student would move more restrictive when they're not doing well academically, emotionally, behaviorally. There
Okay.
isn't a set in stone, you have to get X score, be this. There isn't like a
Okay.
written test specifically. But
Mm-hmm.
typically, we wouldn't move a kid more restrictive unless there were significant concerns throughout the year. You can request I mean, it sounds like your kid's going to be up for reevaluation soon because their assessment, well, you did have them reevaluated already. So
Yeah,
you
I
could
did.
recommend updated testing. You could also recommend just updated educational testing, because oftentimes decisions can be looked at based on if the academics are poor. And then
Okay.
just to give you some sort of number, um, typically students who are performing 16th percentile and below on academic measures, we would call below average. So let's say you got updated academic testing and your child were performing below the 16th percentile across math, reading, writing, all the measures. At that point, most likely, more times than not, they will say the current program isn't working. We might want to look at something more restrictive. But that should be a collaborative process in the CSE. They shouldn't just be
What
telling you, it should be a discussion.
the 16 percentile, is that based on iReady or is that another testing measure?
So it's usually like academic achievement testing. Oftentimes schools will use what they call the Wyatt or the WJ achievement. They're standardized measures of academic achievement.
Okay, perfect. And then, and again, I don't want to bogart this whole call, but if I wanted to get her neuro psych eval and not spend $7,000
Hmm.
out of pocket, can I get a
Yeah.
voucher from the DOE?
So basically, you would write them a formal letter saying that you disagree with the evaluation that they completed and that you are requesting an IEE at their expense.
IEE.
Yep, an
Okay.
independent educational evaluation.
Okay. And last question, I promise I'll just listen.
Sure.
If they do pay for the IEE, are
Hmm.
they now like kind of in control of next steps? Because I didn't go through the private route. I think that was also another concern of mine.
No, so the IEE, they're just paying for it. But like for
Okay.
example, you could have a private entity like Manhattan Psychology Group do the IEE for you. The DOE is paying for it, but we don't work for the DOE. We just do the evaluation as an independent evaluator. The
Okay, so
alternative,
you
if they don't grant the IE, that's when it would go through you filing for due process with a legal complaint.
okay. Okay, perfect.
If I can
And
jump in really
and then
quickly, I want to, if
yeah,
we
of
can hold
course.
on for that second, because we have a couple of questions that have also come in. I have a parent that wrote in Spanish that they think their son, apart from autism, also has ADHD. What type of evaluation should I do for that?
So again, it would just be a neuropsychological evaluation because we look at everything. So we really don't delineate, we don't have a separate ASD autism evaluation, a separate ADHD. We would look at everything. So at the end of the day, the answer is the neuropsychological evaluation because it's going to be the most comprehensive.
Okay. And then let's see. Also, can I just ask my son's primary care doctor for a referral to do neuropsych evaluation instead of asking the school?
Um, you could, but that doesn't mean the school will pay for it. You typically have to start at the school level and if you want the school to pay for it, you have to have them do their evaluation first. You then would have to put, if you don't think that they looked at enough at that school evaluation, you would have to put in writing that you don't agree with their evaluation, and then that's when you would request the IE. So you could have your primary request the evaluation. It's just you would still be responsible for paying for it at that point.
I don't mean to jump into the conversation, but sometimes when you go to the primary care doctor, this is Miss Martin, I'm sorry. Sometimes when you go to the primary care doctor, the only answer to them is medication, medication, medication. And it's
Hmm.
not always about the medication, especially when they go to school. They have to learn. So with that being
So
said, it's
true.
just like where do we go with that?
Yeah. Well, I think that if you're seeing concerns it depends on the concern, right? If, like, let's say at home you have behavioral concerns, chances are they're seeing it at school. And if there are behavioral concerns at school, the chances are that it's impacting the student's academics. So at that point, that is when you would make the request to the school to do the evaluation. So
But the
yes,
IEP,
yeah,
when we had the IEP meeting, he's
yeah.
excelling. He's excelling at his greatest. He's excelling.
Mm,
Everybody, we got the IEP. He's excelling, and it's just like now when they put them on the medication, it just turns the whole behaviors around.
right.
So it's like, what are we supposed to do with that? Because we could take them to the primary care doctor. The first thing they're gonna say is medication, and then when you put them on medication and it's not working because it's not working for your household, and that changes the dynamics of everything inside of your household, what do you do with that?
Hmm. So if things are going well at school but at home they're not going well, at that point you could seek support for the home environment. If I think what you're getting at, I just want to make sure I understand your question correctly. If you also just are at a point where giving the medication doesn't work, so you're saying, well, what if we stopped that? What sorts of interventions do we have? Is that what you're asking more of? Because if you're giving the medication and it's working well, then and a student
So
is able to access intervention at school,
when
generally
giving the
that's positive.
medication, giving the medication, they give it to them in increments. So
Right.
if they put you on medication, they start you off with the lowest dose first, and then week 2 you got to go to this dose, and then week 3 you got to go to this dose. But then when you get to week 2 and you start the second high dose, it's not working. Like it's working, but it's not functioning. Like
Right.
my kid, he was okay. Like we had this under control. We had a routine, no problem going to school, nothing. But now all of a sudden, it's done.
Right. So
And
I
then
would say that, yeah, that might be a bit outside of what I'm talking about in this presentation. I would direct you back to the psychopharmacologist if the medication is no longer working.
And Miss Martin, please do know that is one of the things that is nearest and dearest to my heart, talking about medications, stimulants, non-stimulants, how it works with our children, what doesn't work, moving through the process of finding a psychiatrist and those types of things. So we will be looking into having a follow-up workshop to actually talk about those things in specificity. So I'll remember to make sure to add you to that email chain, because I know you, like me, need support in that space, if that's okay.
Okay, thank you.
You're more than welcome. One parent did ask here, how will I get this paid for? I think you mentioned it. And do schools normally test for everything, e.g. ADHD?
Typically, schools only do a psychoeducational. They're typically only looking at the cognitive intelligence and academic. So if they were to do that and your concerns really were more attentional and they don't assess for that, at that point is when you could write in, I disagree with these findings. The attentional concerns that were brought up were not evaluated for. I am requesting the IEE.
And there are
If you have,
developmental doctors
yeah,
too, right?
yeah.
Who
And
do
again, no, you go ahead.
I was going to say there's developmental doctors that you can go to. I know that we went to Summit Wild Cornell, who had my son
Mhm.
diagnosed with ADHD. So there's different spaces and places that you can go to get the diagnosis that don't necessarily cost you, that do go with insurance.
Yes, the one thing I will say is sometimes schools will say that they won't accept the diagnosis unless it's via a neuropsych. Sometimes. So just one thing to consider.
Yeah, I will add my caveat. Mine went through a lawyer. I got
There you
the from
go.
my doctor, and then it went through a lawyer. So I had a different level of people
Yep.
advocating for me on the backside. I do have this. How long does an IEE, an independent evaluation, take to be completed if you requested it from the DOE directly 2 months ago?
Have they started do you know if the evaluation has started yet?
To actually, from Miss Stephanie Lee, would you like to come off mute to speak? If she's still present with us with the IEE, if you requested it from the DOE. 2 months is a long time.
Hi,
Yeah.
can you hear me?
Yes, ma'am.
Yeah.
Hi, yes. So my daughter, my daughter is 6. I want to say that first and foremost. She is nonverbal. I've been having a communication issue with her current school. um to the point it's gotten so bad to the point where like I kind of pulled her from school because I'm aware of my rights and I'm aware that I advocate for her pretty frequently. She does not speak, you know. I've been requesting a meeting since she got to that school. She got to the school back in November. We've been kind of switching schools because I came from Queens to Brooklyn. Now she
Mhm.
got to this school, you know, I explained to them what she had, and she came from a community school, so that was also like really bad because like she went from a 25, I think, classroom, and her IEP she got later that June of last year. Now fast forward, we're into the Brooklyn school. She is now in a 12 one-to-one, but I
Mhm.
have been requesting specifically from the IEP CSC. You know, I don't agree with it. I've been saying it for months and months. And so I asked a recommendation from her current school. But when I tell you I don't get no communication from them, I always have to show myself physically, if that makes sense, like, and
Mhm.
see what's going on. But I'm never getting any answers that I would like to have from the entire staff. We're talking from guidance counselor down to the principal, down to the vice principal. And I have yet to meet the actual principal because I now know that she takes care of I guess multiple schools. But my bottom line is since I pulled her from school, she has not been in school for like I want to say a month and stuff because I've been trying to get an answer from D75 themselves. I
Mhm.
have a paper trail of who I've been speaking to and what I've been requesting, and I haven't gotten any answers. So fast forward, I had a meeting with the vice principal. He kind of disregarded what I was saying. Like he dismissed everything I was saying just by saying, like, well, she's been absent. Like, how are we gonna um take care of her if she's been absent. But I'm like, you guys know why she's been absent. I've been asking for a meeting from since, March.
Mm-hmm.
Basically, I took it upon myself to do a lot of research. And I requested, I think an independent evaluation from 2 months ago too. So prior to this meeting, I did what I had to do. I spoke to a lawyer, and I also spoke with the state who actually developed these IEPs, right? Um,
Mm-hmm.
and I think the person that is doing the independent evaluation has requested it. But again, since I'm not getting any communication, the only time I communicate with this school, and I'm just not comfortable with my daughter who is not speaking, right?
Mm-hmm.
Going to a school where they do not communicate with the parent at all. The only time they call
Yeah.
me, honestly, when she's absent. Like when
Mm.
she's not there, hey, where's she at? How's she doing? But when I do go to the school, no one in the entire staff can tell me what's going on with her, where she's at, how she's doing. And it breaks my heart because now, she's kind of set back from a lot of things, including her
Right.
report card. They just put, she's been absent and that's her grade. And as a parent, like, I just feel very defeated because I feel like I'm not being heard or seen from my aspect, from the person that's speaking, from a person that's not speaking. I'm just trying to figure out how to really navigate. Because I've tried to ask for multiple transfers from D75. Only
Right.
D75 has is an email. That's
No,
not
no, Miss Lee, I want to jump in there for you. I don't know
sure.
where your emails have been going, but you have us. You have the Citywide Council for District 75. If you would please, I'll put my personal email in here as well. If you could reach out to the council and or myself, I will expedite this for you. You are not alone.
Oh my God,
You
thank
need
you
to be in a
so
place where
much. I
nobody's
just
talking to
really
you.
didn't know how to navigate the situation because, we're all mothers and we all
Yes.
have, kids on the spectrum, and it's been really hard when you don't know a lot of certain things and how to navigate it, right? So
I put
thank you
my
so
phone
much.
number and my email. We can try to connect later on today. Your baby should not be in school. You should not be in a place where people are not communicating with you. That's problematic, period. And we will go ahead and work that over and make sure you have the direct people that you need at the district and the school to push forward what you need to have happen.
Thank you so much, Miss Angel. I really
You're more
appreciate
than
that
welcome. You're more than
from the
welcome.
bottom of my heart. Thank you so
Yes,
much.
yes, absolutely. Miss Mindy, you have the floor for your question. Are you able to unmute?
Oh, hi, I'm sorry. Yes. My daughter has an appointment. And I saw somebody asking actually the same question or similar to the one. I have an appointment for her actually in a few week in next week for a neurologist. What do I need to expect on that appointment? Because that's my first time taking her there. What do they do there exactly? Because the reason why we're taking her there is because of behavior.
Mm-hmm.
So I just want to know like a gist of what to expect if you guys have that info.
Are you
So what,
taking her for a neuropsychological evaluation or a neurologist?
Neurologist.
so what
Okay.
they do
So,
is you have to do the EEG and the MRI because they're gonna ask you. I'm sorry, Miss Jessica. They're
no,
gonna
go
ask
ahead.
you.
You will
They're
know
gonna,
better than I do, it sounds like.
I'm sorry. They're
No,
gonna
you're
ask
good.
you. They're gonna ask you basically like, do your child hit their head? They wanna if your child's on a spectrum, they're gonna give you an ASD questionnaire. They're gonna ask you if your child bangs their head against the thing. If you say yeah, they're gonna send them for an MRI and an EEG. Once they go for the MRI and the EEG, they gotta put your baby in sleep. They gotta put your baby to sleep. They got to put them under anesthesia. They're going to do their testing, and then after that, that's when you get the answers that you need.
And all this happens at the first appointment, or that's like a follow-up appointment after the first one?
All right, so the first appointment is where they give you a referral. You got to get the referral. You got to go for all of the stuff that you need to go for is basically like blood testing, making sure that the baby iron is all right, making sure that you have to ask the neurologist going to ask you all the questions about if your baby hits their head, stuff like that. And
Mm-hmm.
then after that, they'll give you a appointment to take to the doctor, to the hospital, or whatever the case may have you, wherever you live at. You have to get you got to get an EEG and an MRI, and then after you get that stuff, then you go back, and then you get to see the neurologist, and that's when they make the decision.
Decision for what exactly?
Whatever you going, if it's a behavior issue, if you want to put your baby on medication,
Oh,
whatever
okay.
the case may have you, that's when
Uh-huh.
they give you the information that you need.
Okay. All right. Okay. So that's okay. All right. Sounds good. And I also want to piggyback on the other parents, the previous parents I had the issue with the for the school. I feel you, girl. I'm so sorry that's happening to you, and I hope your baby gets all the resources that she needs because that's honestly fucked up. And I feel you, and I'm with you
Thank you
on.
so much.
And what school is this, by the way? If you don't mind sharing.
Yeah, of
Guys,
course.
guys, guys,
She
guys, we
goes
don't
to
confidentiality. We don't want to put out anything
Okay. All right.
for our kids.
Okay, honey.
sorry.
Best of luck for to you and your girl.
Thank you so much.
No problem.
We do have time for one more question, Miss Siobhan Kennedy. You have the floor.
Hi, it's not a question, it's more like a comment because my question was answered. One, I just want to say that most children who are diagnosed with autism, this is just to the moms because my son is older. They usually have what they call a comorbidity, so it's usually two diagnosis that most of the kids on the spectrum have. And the second question I just want to say, and I don't know if this was done or not, but when your child is medicated, and if you just stop the medication immediately, I'm going to say it does do harm to the child. I've experienced that because my son, he no longer wanted to take the medication, so he just stopped cold turkey, where it's supposed to be a weaning process, just like it's incrementally dosages are increased. If you want to remove the medication from your child, you should, you know, go reverse, start breaking down the dosages. And I just want to say that to some parents. The
Ooh.
medication also, I've been through the fact that, we kind of want behaviors to be changed. And really, that's really not what the medication is going to do. I just want to say, at least from my experience, right? Because the school wants the kids to behave in a certain way, and sometimes the medication, that's not what it's going to do. Like if you're anxious, you could take an anti-anxiety medication, but it's not necessarily going to work. Like you said, you do have to try to do a search for the medication. And also, I just want to say to the mom, I understand your pain that you're going through, but also be careful that you removing your child from the school, you don't want to be charged with educational neglect. And I think that's something that just should be said because the school can go, that route also. So be careful about that.
We have your back there. We're not going to let you get into that space. Just know, because with what she was saying, there's a lot of different layers there. So we're going to go ahead and get on to help Miss Stephanie with her daughter. Additionally, guys, I do want to say this video, I know it's a huge question. It was close to my heart because my son is 20 years old and I've gone through a lot of this and I'm still going through a lot of it. So I appreciate all the parents who came today. I appreciate the Manhattan Psychology group. I know we had a hard stop and they still kept going. So I appreciate you. Parents, do know this video is going to be on CCD75's YouTube. So you'll be able to go back and play the video. And if you still have any outstanding questions, please do email the council at d75council@schools.nyc.org. And we'll make sure to forward them over to Dr. Janicola and look for any other additional resources where we may be able to help you. So with that being said, I want to give it back over to Dr. Janicola to give us any last closing words. And thank you so much again for your presentation. As we know, we may need to do this again and of course, piggyback with our medication series.
Yes, thank you. I'm happy to create, another presentation based on the questions to tailor even more to all of your questions you guys asked. Wonderful questions. I really appreciate all the vulnerability and sharing what each of you are going through. And I hope it's, helpful to know that you're not alone and you have a community to listen and provide supports. And yes, we are all here to help. So please, you'll have our contact information at Manhattan Psychology Group. I welcome any questions that linger after this presentation and or doing another one. Thank you all so much.
That's going to be a yes and a yes. We will bring you back, Dr. Janicola. Thank you again, Manhattan Psychology Group. Thank you, parents. For the next session, we will have interpretations, guys. We will make sure to have equity in this space. So thank you again for coming to our Lunch and Learn. Please do have a great day. And again, if you need more questions and more help, don't hesitate to reach out to us. Have a great day, guys.
Thank you.